The Care Quality Commission will publish their report this week, and this follows on from their unannounced inspection to look at the emergency department and imaging diagnostics back in March. The good news and the positive things to come out of the report is that imaging diagnostics have made huge progress since a previous report by the CQC back in 2019. In particular, CQC really commend the work of the leadership team and all of the staff with the improvements that they've made. In particular, the way in which we put patients first, the way that we manage the incredible demand on this service and a growing demand, that the views of staff are included and valued, and that there's always good ideas about what else we could do to improve and innovate. And this is really terrific news for that team. I know they've worked so hard over the last couple of years. The report for urgent and emergency care, and specifically the department, has not been quite so positive though. And colleagues will know that we're just coming out of a pandemic. We've been working so hard to manage the demand that is coming to the hospital now, and this includes an urgent and emergency care restoration plan that we started way back in January. And we know that although the main focus tends to be on the emergency department, hospital flow, supporting our most poorly patients through urgent and emergency care is a whole hospital and in fact a whole system of health and care responsibilities. I know all the staff will be really gutted, as I am, that the CQC have also issued a section 29A for urgent and emergency care, which is a warning notice. It's a way of saying to us that we need to make significant improvements that are embedded and sustainable really quickly. And we're expecting CQC to come back probably in June or July. So staff have already been working really hard to put our patients first, to make sure we're as safe as possible. But you'll see in the media that the key issues are around the time it takes patients to be brought into the department from ambulances that are in the car park, time taken for triage, and then getting them to the right bed in the hospital should they be admitted. We need to improve the way in which patients can access other services, urgent and emergency care services, not just the department. We need to make sure that our infection control is absolutely above board at every point. This is really difficult in a crowded department. Governance and making sure that we've got the right staffing levels to meet all of the demand that we've got in our services. This, I know, will be a real point of pressure and concern, not only for the staff in the department across the hospital, but also for the public. So it's really important that we emphasise our services are safe. We have a whole hospital looking after the emergency department and supporting them in the huge pressures that they're now facing. Within the hospital, we're doing everything we can to make sure that patients are treated and assessed in a really timely way, with care and compassion being right at the top there. But it's also really important that the hospital doesn't work as an island, and we're working with all other services to make sure that if there is a safe alternative option to coming to the emergency department, then we use it. In particular, I would really like to encourage the public, unless it's a real accident and emergency, that you use the 111 service. They'll be able to help you, support you, perhaps direct you to some alternative suitable services. And if really necessary, they can make sure that when you do come to the emergency department, we're able to see you in a way that, in a timely way, that is best for the condition that you're presenting with. And I think by using all of our alternative services, then we can make sure that only the people who really need to come to A&E can, and that we're able to treat those patients in a timely way with the highest clinical priority. Thank you for your help and support on this.